So topic today is reproductive anatomy. This anatomy is divided into two. One is internal anatomy and external. In this lecture, reproductive anatomy. Internal, the female reproductive tract. These structures are like this. Starting from the ovary. Then this is known as the oviduct. This is the oviduct, and these are uterine horn, structures from the oviduct till cranium. They are derived mesonephric duct, Mullerian duct. This is the origin, and this ovary, their derivation. So these are the internal to cranial vagina, vestibule, and yeah, that comes in external. So ovary having origin from gonadal ring, from oviduct to cranium, it is derived from Mullerian duct or pyramidal duct. So first will the structure, shape, and species difference of the structure called. Is oval. Second is bean or kidney shape. Is the almond shape. So these are the this oval shape present in BVFC species. V for ovary, S for cat, so cattle. Beans or kidney shape only present. Almond shape is present. Eve, that is your sheep. Six shapes. The shape, if we see ovaries are located. In case they are located, in case of page, just beneath L3 and L4. In case of L4, in case of mare, they are located below O and L. And but in this location is as pregnancy as per in case which is pregnant, large in case of pregnancy, and horn, big trine horns, they move ovaries. They move the ovaries for fifth of pregnancy. Pregnant. Ovaries are out of as per by the fourth or fifth month in case of cow. Some of right versus more active in case of cow, less case of camel. Right, the size of then the with respect to size. In case of cow, right is more active. Size is second. Species differences. Number two, in which is Persa. There is in other species. The difference of bursa formed from proper ligament of ovary and meso-ovarian, which is the in case of which formed a salping. This is the difference. In other species, bursa is found from meso. In case of which this bursa salping. Mayor kidney says ovary is kidney ovary. Fossa. Next is the ovary. This is the ovary, which is having some structure, and this is the that is the in mal. This bursa filled we call bursitis, so, which is seen in cat ovary. Second, on the surface of ovary, hema follicle. Follicle. So on the and this bursa hydrobursite. Hemorrhagic corpus luteum is more prominent in male. Case of male. Next is the covering of ovary. If we see a ruminant, this is the ovary, and this ovary is covered. This is covered with surface epithelium, which is voidal epi, simple cuboidal. So in case of this ovary is covered by surface epithelium, fully covered voidal epithelium. In case of mare, kidney shape, like this surface epithelium ovulatory fossa. The surface epithelium is present in fossa. This part, the remaining part, tunica, is called tunica. Epithelium, the ovary in case of dominant. Of mare, it is present ovulation fossa, known as tunica. This, in case this surface, it is invaginated. This epithelium as are known as cortical tubule. Surface epithelium, cow, mare, and bitch. In case of cow, it is all around. In case of mare, present here, ovulatory. Case of bitch, related. Called cortical. Here, all around, here, cortical tubules. As the species difference epi. So this part is over. That is your part. Now, part. This is part. Uterus. body, ovary is turned cranial and tube. One into abdominal cavity. And this opening into, so the name for this opening is abdominal. This is the ostium uterus because it is into the uterus. Is having two openings. It is having two openings. This part has in the column, and this part is known as ampulla. Part is the isthmus. So there are two openings, one open into the abdominal cavity and this into the uterus. After this, these are three parts and isthmus. Ampulla isthmus. Ampullary junction. Ampullary isthmic junction. Is this junction and uterus and uterus. So uterus junction. Fundibulum. In fundibulum, the site of in case of this AI site of fertilization. In case of mammals. So two opening, two function. In fundibulum, fertilization for the poultry, and AI junction, site of fertilization for the mammals. One more this AI junction. AI junction and for what? Point only fertilized into oocyte to pass. In case of male, oocyte will pass toward the uterus. This point, they will after 1-2 months they will be absorbed by the viaduct. AI junction is a control, is a site of mammal. Similar to this AI junction is also act as a control point. Also act as a control. Where as a point. So in case of saw, utilization, control or prevent access of entry. That is, it prevent sperming, polyspermy. So this in case of mare and act as a so point. So if these two junctions, I junction present, it is present in male T junction present. Thus, it prevent polyspermy. This junction is also present. What is the role or control point? If there is high estradiol or if there is low, high means stress and form means it becomes like it form a band. When there is low estradiol becomes kink. At this point. This is the kink. This kink prevent entry or movement of embryo into under high estradiol in case of cow. Form a kink or band. Here is the fertilization. Embryo is formed. It does not allow embryo to enter here. But when there is low estradiol, this kink becomes straight, and it allows the embryo to enter. So prevent poly junction in case of cattle. King and Shan. This king there is and estradiol. So here is the This is the embryo after birth. Embryo can easily enter because of this kink, because high stradivarius is straight, embryo enter easily into the. So this was about role of these junctions. This is ovary and if we move to this end, then muscle thickness will increase. If muscles are more thick, it so here we have more diameter. Here less diameter. Or here thick muscle. So as we move from this end to this, something about viduct of oviduct are found. Ciliated cells and ciliated may be ciliated and on ciliated cells. These are the non-ciliated. P is secretory cells. Duct cells, non-twin split. They are called PEG fat cells. Secretory means these cells have secret granules. Motion, mode of merocrine. Appear or cilia reappear. Disappear and one is answer is and pregnancy. It is sick. And one is after hypophysis removal, hypophysectomy. These cilia disappear. When they reappear, there is estrus. These phases, there is no cilia during these two phases. These ciliation, we can say that hormones. This is hormonal control by the hormones. If we at the duct, so what we find, some are the ciliated cells, are PEG cells. Again, the role of these cells secretion is the secretion. In 2018, they who control oviductal secretion. Answer is ovarian steroid hormone. That is estrogen. That is estrogen. So this is the oviduct, two types of cells, non-ciliated or secretory or PEG cell. Then these secretions, the mode of secretion is merocrine mode of secretion. These secretions who control hormones, that is estrogen. So from oviduct. So oviduct, we saw ingulum to junction. Role of these two junctions. This was about ovary and now uterus. Here, it is shape of the uterus. T shape. T shape. That shape by shape. So in pitch. In case of, but voice shape is more in case of pitch. Voice shape. That is pitch have voice shape uterus. So based degree of fusion. Based on degree of the number one, we have bicornuate uterus. Bicornuate uterus. Bicornuate uterus means two uterine horns, one uterine. These are the uterine horn of male. This is neck of uterus called cervix. One vagina. One vagina. This is bicornuate uterus. Sec duplex uterus. Present and vagina. The difference between these two vaginas remaining same. Two vaginas. Thus, the uterus. This layer is an endometrium. This is known as endometrium. Endometrium is having gland. It is having gland. Their secretion is called secretion, and this is pregnancy. Pregnancy, not during the cycle. So, secretion. Second, from you, there are serine proteins. Number one, that is secreted in case of uteroglobulin. Uteroglobulin. Then one more protein that is known as secreted in case of A. Then something with this endometrium, caruncles. Caruncles may be, you can do X. Think cow and tail is for that is X. Case of cow, they are convex. Then in case of sheep, they are concave. They are concave. And of mare, of sow, these are absent. So structures related with the glandular secretion to support the embryo. Uterine protein, kinin, rabbit, uteroferrin in ewe, equals W with cow, X with convex, and in mare, nothing. That is Myometric myo is called myometry. Myo means there it's a uterine motif is uterine muscles, that is contraction, that is this motility is maximum in estrus E2 because of estrogen. So this estrogen increase motility of the motility. So in a pregnant cow, so it motility and progesterone decreases the motility, and it is maximum in case of estrogen. So after ovaries or this oviduct and uterine horns, uterine body, neck of uterus, that is your cervix. It is also called as it is neck of womb. That is the so cervix. What it is having? It is in predominantly connective tissue fibers like collagen fibers, reticulum, and elastin fibers. So predominantly connective tissue, and in small we have smooth muscle. Smooth muscle, the glands, and glands are known as neck glands. These are Nabatean glands. Secretion. Secretion is called as cervical mucus. Cervical mucus. First, we'll see this difference. Cervix. Number one, it is poorly developed. Developed in which? In multiparous, litter bearing. It is poorly developed. Second, rings or fold. If we look in case of ruminant, they have 5 annular, but number is given, then answer will be usually 4 rings. That is in case of ruminant. The role of these rings, like this, they together and close cervix very securely. They will fit together and close the cervix. This is the cross section. In case of ruminant, usually 4 rings are there. 4 rings are there, and they will close. prominent, mainly remember cow and eve. More prominent. These are more prominent. So what we prominent are for rings. Four rings are there. Number two, we have longitudinal. We have folds. If this is the cervix, these are the folds. Folds. No. So because of this, easily perform, we can AI mayor. These are longitudinal. Number three, in case of corkscrew type. If this is the cervix, these are the corkscrew type. In case of bitch, canal is perpendicular to vagina. Therefore, it is perform to perform a difficult to perform AI. It means this is the vagina of the bitch. After this, these are the muscles, and it will becomes like this. So, cervical canal, cervical canal is perpendicular vagina. That is second thing. In case of bitch, there is pseudo cervix. Pseudo. What is pseudo cervix? Vagina, cervical canal. Here, there is dorsal fold, dorsal median fold behind. This is known as para or pseudo cervix. These are the cervix species difference. Related with the cervix, something called Nabatean, and they secrete cervical, and this mucus is having pH of 8.4. It is having predominantly type. It is having protein, carbohydrate, these type. But most important about cervical is rheological properties. What are rheological? One is number one pattern or called crystallization. This is due to high content. Sodium chloride get crystallized. One pattern. Number two, elasticity. That is also known as ability. How stretch the cervical mucus. It is used or it is detected by one test called spin barket test, and this was asked in ICAR 2020. That elasticity or the stretch ability of mucus is measured by spin barket test. Third property is the viscosity. Fourth is the thixotropy. These are some of the property of the cervical mucus. If we see this cervical mucus, its secretion increases when decreases. More secretion when high estradiol. Secretion decreases, progesterone is high. Luteal phase, that is pregnancy, pregnant cattle. In case of pregnant cattle, there is one term, cervical plug, means cervical mucus thick, viscous cervix. That is the cervical plug of pregnancy. Structure. After cervix, we'll see cranial, vagina and caudal vagina. Up to here, these are the derivative of paramesonephric duct. There is urinary bladder, urethra, and it gives rise to caudal. So this is one derivative, these are one derivative. So in case of vagina, structures which are present are muscles, organ, not fibrous, it is having muscles. In case of cow, anterior and posterior sphincter muscles are present. Sphincter muscles present. Number two, in case of there is no glands are not present. Then source vaginal fluid is there. Then what is the source of this vaginal fluid? This is the date, transudate, coming from three sides. Coming from the cervix, coming from the uterus. Also because there are no glands. Because there are Histology, if we say, there are, in case of cranial vagina, there are column, simple columnar, stratified, squamous, in case of caudal vagina. So, and cervix is the cranial vagina. These are the folds. The fornix. This for absent in case of so. In case of so, this fornix, which is a part of cervix or fold. So these are different. We revise what we learned today. This is cervix, cranial, vagina, and caudal, and these are the labia. And these are the uterine horns. These are the ovary. Shape of ovary and species difference. These are important. Viaduct, type important. Page cell and ciliated cell. Uterus, static, and is having double origin, two types of histology. We'll see external reproductive anatomy.